Okay, in health news, on a scale of 1 to 10, how stressed are you? Think about that number and listen to this. Stress can trigger inflammation in the body, chronic pain, depression, anxiety, and autoimmune diseases like lupus, fibromyalgia, or rheumatoid arthritis. Joining me to take a deeper dive on this morning, Dr. Brooke Goldner, an autoimmune disease specialist. Good morning to you.
Good morning.
So, Dr. Goldner, what are autoimmune diseases, and are you born with them? Are they genetic, or can you just sort of wake up one day with these issues?
So autoimmune diseases are a series of types of illnesses that they have a genetic component. Listen, all of our bodies have a genetic possibility chart, I guess you'd say. Many people are born with a predisposition to heart disease or diabetes or cancer or autoimmune disease. So that's kind of your potential of what you could get. But those genes need to be turned on, just like you don't wake up with a heart attack or when you're born, right? You're not born with that. You're not born with type 2 diabetes. You're not born with the autoimmune disease in place usually. It gets triggered over time by a collection of things that we do to our bodies. So unhealthy eating creates inflammation, stress, emotional trauma drastically increases your risk of autoimmune disease, poor sleep, all of those things create the right conditions that can turn those diseases on. But thankfully, with taking care of yourself the right way, you can turn them off again, as I do in my practice every day. I used to have lupus. I had it for 12 years. 15 years now, I've been lupus free, all by changing those conditions, taking good care of my mental health, as well as eating right and managing that stress.
Yeah, wow, that is incredible. I got to talk about COVID-19 here because people living with autoimmune diseases are considered immune compromised, obviously. So what are some of the best practices you would recommend for your patients, whether they have COVID or maybe they're recovering from it or maybe they're still trying to avoid it?
Yeah, absolutely. And I have a number of patients that have gotten COVID, including other doctors. Listen, the things that we need to do are the things really everybody needs to do. So number one, of course, use precautions. Wear your mask, keep doing social distancing. Everyone's not vaccinated yet. There's still a lot of risk out there, and we have very high rates of infection right now. In addition, you got to make sure you're taking good care of yourself. A lot of people were staying home, watching Netflix, eating junk food, not exercising, right? So you really want to take great care of yourself. If you're feeling stressed, do self-care that makes you feel good, whether it's yoga or exercise or working with a therapist to help keep yourself calm and happy, in addition to finding some way to be social with other people, even if it's online, because being isolated can make you depressed. And eat your salads, drink green smoothies. Those vegetables will help you stay nourished, whether you're trying to heal from COVID or just keep your body as healthy and resistant as possible.
Yeah, those are good tips overall. You're right. You mentioned inflammation, and so did I, but can you maybe break this down, explain inflammation? I know that it can lead to debilitating pain for some people, but what is it, and what are some of the ways that we can reduce it in the body outside of just anti-inflammatory medication?
Absolutely. So inflammation is a normal thing for the body, right? If you bang your knee on the corner of the bed and clumsy like me, it gets inflamed because your blood's sending markers in there and helpers in there to fix the damage. If you get an infection, your inflammatory immune system kicks in to help you. The problem is if that inflammatory response is in overdrive because you have high stress, which can cause it, poor sleep, you're eating excessive amounts of processed foods and meat and dairy and takeout and all that stuff, then you can get that inflammation going all the time, which can trigger those disease processes, those genes we talked about. So it's not inflammation in itself that's bad. It's chronic inflammation that's being driven by our unhealthy habits that can then trigger those diseases and make us feel sick.
And that is why it's so important to do all the things you said: eat well, exercise, keep the stress levels managed if you can. Dr. Goldner, thank you so much for your time this morning.
It's my pleasure. Thank you so much for having me.